I was getting ready to go for a run, literally got a block from the house, and my shorts were soaked. I was disheartened, I was upset, I was embarrassed, and thinking, you know, is this something normal that happens after your first child?
It's an embarrassing thing to have to explain to people. Who wants to say, oh, excuse me, I had a little accident when you're an adult?
I'd heard about stress urinary incontinence, and until this happened to me, it was like something that happened to somebody else, and it wasn't even going to impact my life, and all of a sudden, there it was.
If your doctor's telling you that this is a part of getting older or something women go through, or even some doctors say that because you have vaginal births that this may occur, I say get a second opinion.
Like millions of other women, each of these women suffered from an embarrassing, uncomfortable condition called stress urinary incontinence, or SUI. The good news is that you can do something about it. The more you learn about SUI, the sooner you can take back control of your life. Bonnie Blair, U.S. speed skater and 5-time Olympic gold medalist, knows firsthand that any woman can experience stress urinary incontinence.
I think having SUI, the one thing that really bothered me the most was running and having the accidents when I would run. But I would also have accidents just around the house. Simple things, picking up a bucket of laundry, picking up my children, you know, even just laughing, having a cold and having a really bad cough or sneezing. And maybe those accidents wouldn't be huge, but enough to make me feel uncomfortable, have to go change my clothes.
When my husband and I would go out to walk after dinner around our apartment complex, and I went to step up on a curb, and all of a sudden I just had urine running down my legs. I was mortified. And I thought, this is a big deal, this is a big problem, and I need to seek help.
Stress urinary incontinence is the sudden unintentional release of urine during normal everyday activities. You may have SUI if you lose urine when you cough, sneeze, or laugh, walk, exercise, or lift something, or get up from a seated or lying position. If you're experiencing SUI, it means that movement that puts pressure on your bladder causes your urethra, the tube from the bladder through which urine exits the body, to lose its seal and allows urine to escape. SUI can affect women of all ages for a variety of reasons. Some factors that might lead to SUI include pregnancy and childbirth, chronic heavy lifting or straining, menopause or estrogen deficiency, and obesity.
It started out just drops here and there, and when I would exercise, cough, sneeze, laugh, a hearty laugh. And it grew to a situation where I had to carry panty liners, and by the time I got home I was wet and had to hang up clothes to dry out.
If I were to cough, I would have a spurt, as though you had a garden hose and gave it a quick jolt. If I were doing prolonged laughter, it would be prolonged leakage. It was pretty much a correlation between the two.
You're always planning your day around where is the next bathroom, or if I have an accident, then what am I going to do? And all of a sudden I realized that I couldn't find a lot of my underwear. And I thought, well, where did they go? They were in the glove compartment. They were in every purse I owned. I would find a pair of underwear because I always had to be planning, all right, if I have an accident, what am I going to do? So that's basically what your life becomes. It's not nice. So I went to my family physician, and he, of course, put me on more medication. I just was not convinced that this was the right answer, but I continued to do what he told me, and my condition got worse.
You can do something about urinary incontinence at any age, no matter how hectic your life is. Today, you have choices, including safe and effective minimally invasive procedures that can help you control this condition, stay active, and be confident.
I've always been reluctant to take medication. I've always tried to go more the natural ways. So I didn't want to go that route, and I felt that if once I got on that kind of medication, I'd be on it the rest of my life. I didn't see the problem getting better. It only seemed to be being exacerbated as time went on. So when I heard about the surgery, that to me sounded like a clean fix, something that would be permanent, and that's really what I was interested in.
I would want women to know they should go talk to their doctor, get some help, see what the different options are, because there is a way that you can get your life back to the way you want it and be happy once again.
When I sought the second opinion from the physician, he told me that this was a simple case of incontinence. The TVTO procedure that I would be using was a piece of tape that would be put in my body, and it would just eliminate my problems. And it was like this weight was lifted off of my shoulder when he told me that.
Gynecare TVT Tension-Free Support for Incontinence is an innovative, minimally invasive outpatient treatment with proven results for the effective treatment of stress urinary incontinence. It is the only treatment of its type with demonstrated long-term clinical results. It's clinically proven, safe, and effective. Gynecare TVT stops urine leakage the way your body was designed to, by supporting your urethra. In women with SUI, the weakened pelvic floor muscle and connective tissue can't support the urethra in its normal position. To correct this, using Gynecare TVT, your doctor will insert a ribbon-like strip of mesh under the urethra to provide support whenever you stress this area, such as during a cough or sneeze. This allows the urethra to remain closed when appropriate, preventing involuntary urine loss. The ribbon-like mesh is made from a permanent material that will be well tolerated by your body. It will be there to help support your urethra for the rest of your life. The procedure is short. It usually takes just 30 minutes. You will be comfortable and may be asleep during the procedure. You will have 2 tiny incisions, either just above the pubic bone or near the creases on the thighs. More and more, doctors are turning to Gynecare TVT Tension-Free Support for Incontinence. The surgery can be performed under local anesthesia. It's less invasive than most other surgical options, and in most cases, you'll be back to your normal routine in just a day or 2.
The recovery process from this procedure was really short. So short that I think I wasn't allowed to exercise for maybe 2 weeks or something like that. It was a very short period of time. But I was able to do all my normal activities immediately, and honestly I did not feel hampered. I kind of anticipated that, well, I'll try to do activities, but I probably won't feel like doing it. But I honestly didn't feel that. I felt that I could pretty much do whatever I wanted.
The procedure that he explained to me went exactly the way he told me it would go, from the procedure itself to the recovery. There were no surprises. He was very honest, and he just laid it right out, and he said, this is what I'm going to do, this is what's going to happen, and that's exactly the way it went.
Women trust Gynecare TVT. It has been used on more than 700,000 women worldwide, and 98% of those women report they are still dry or have significantly less leakage 7 years after treatment. 81.3% were completely dry, and 16.3% were significantly improved.
Having SUI definitely compromised my life, and whether it was just me wanting to be able to go for a run from my house or jump on the trampoline with my kids, I tried the different options to help me get better. None of those really seemed to work, but having the TVT surgery was something where I feel like now I've gotten my life back.
After the procedure, I noticed right away that there was a difference, that I could hold my water a little better, and that there was no leakage whatsoever.
It was the morning after the surgery when I sat down to urinate, and I thought there was a beginning, a middle, and an end, and it all worked, and I thought, this is the beginning of my new life. And it was exciting.
The rate of complications with Gynecare TVT is very low. However, all medical procedures present risks. As with any procedure of its type, Gynecare TVT should not be considered if you are pregnant or plan to be in the future. For a complete description of risks, see the Adverse Events section at the end of this video or visit www.gynecare.com. The best way to determine if you are a candidate for this procedure is to ask your doctor. If you are, be certain your doctor is giving you Gynecare TVT, the #1 doctor-preferred treatment of its type.
Since I had this procedure done, I have never had leakage, not even once. As far as I'm concerned, this is the best thing I've ever done. So I really wish I had done it sooner.
Decided to have the TVT surgery, and you know, boy, I've been symptom-free ever since, and has definitely put a smile back on my face.
The patient outcomes in this video may not be representative of the treatment of this condition in all patients.